Hi.
Hello, everybody. Welcome to Knock Knock Hi with the Glaucomfleckens. I am Dr. Glaucomflecken, also known as Will Flannery.
I am Lady Glaucomflecken, also known as Kristen Flannery.
The plumber recognized me.
Yeah, that's true. You have reached the plumbing community.
We had a plumber come over to fix a leaky toilet, and I can tell.
Yeah, they just kind of look at you a little too long.
There were two guys, and I came in. You were talking to him already. I kind of walked in, and one of the guys just like had this like
do I know
I think
you?
I know you from somewhere. And then as he was leaving, he was like, Are you on social media? And I was like, yeah. I didn't ask why, like it reached him in the plumbing community, but
yes.
I mean,
he said your face and voice seem very familiar.
That's right. There are some plumbing adjacent things in medicine, gastroenterology,
Cardiology,
urology. There's actually quite a bit of plumbing that occurs. There are multiple types of different lumen that need to be cleared out.
All right. That sounds gross.
Just blood vessels, colons, ureters.
Any sort of tube is a lumen?
Any kind of tube has
pipes in
a
there.
lumen.
Pipes, lumens, potato.
Think in ophthalmology, I don't think there are any pipes that we clean.
Well, there are blood vessels.
Yeah, we don't clean those.
No. Tear ducts?
Oh, yeah. That's a good one.
Look at me.
There you go. That's a good one. Sometimes whenever you have like excessive tears running down your face all the time. It's different. It's different.
It's associated with sadness.
Crying is associated with an emotion.
Or happiness.
Right. Emotion.
Yeah.
There's a blockage,
Have you heard of those?
You're not experiencing an emotion. I have emotions. I'm having one right now, in fact. When you have tears running down your face that are not associated with an emotion, that's
leaky
pathologic.
Eyeballs.
That's leaky eyeballs. And usually it's because there's a blockage of your tear drainage system.
Mm-hmm.
Now, sometimes it requires like a surgery. You have to like create a new opening because it's so blocked up. But sometimes if you just irrigate it, it like clears out.
The way you talk about this. Jeez.
Sometimes you could just do like a quick little it takes like 2 minutes in the clinic. You just push water.
You know what that's called? A flush.
Yeah.
We're back to the plumbing.
I see what you're saying. Okay. It's like, yes, that's exactly what we're doing. We're flushing it out. I see what you're saying though. Very good.
We need a sound effects board. I would really, really enjoy that. I need to get one.
Okay, so anyway, yes. Well, I don't even know what I was saying. Plumbing, tear drainage. I can flush it with a little saline, and sometimes that alone will clear it out.
Mm.
Yeah,
a little bidet action.
And you just push it through, and then all of a sudden, tearing's resolved. Just like that. That's good. So. Anyway, I was excited to be big in the plumber community. Glaucomflecken and plumbing.
Took a turn right off the bat.
Maybe we should have a plumber come on the.
Maybe that guy.
We could talk about all the similarities and differences between plumbing.
Plumbing, electrician.
They have to deal with so much poop. Plumbers.
Body plumbers.
Yeah.
No. Both kinds of plumbers.
I mean, well.
Body plumbers, yeah, GI.
Yeah, but honestly, most of the colons they see are clean though.
Oh, true.
Yeah.
Yeah.
Still, there's a fair amount of looking into toilets.
Yeah, I don't think I could do that job.
Oh, I know I could.
It's another one like ophthalmologists. I'm very grateful that there are people who can tolerate that job because I cannot. So I can't imagine having to do that every day. But I'm very grateful that somebody does.
Agreed.
Yeah.
All right.
I don't want to deal with that much poop.
That's enough poop talk, I think.
Okay.
How about our live show?
Woo!
We got Iowa coming up.
Yeah.
Our where
We're excited about that one.
Where I came of age as a physician. Where I did my residency training.
You started as a wee baby ophthalmologist.
Where Glaucomflecken started.
True. We're going back to the origin.
That's the origin. Second year residency. It was 2015. Yeah. 2015, I think, is when that started. And I made that Twitter account.
10 years.
I know.
That's nuts.
I've been doing the social media thing for quite a while.
Yeah, you're
Um,
old.
But I'm excited. I've written some jokes specifically for Iowa.
Mm-hmm.
Some special things. My residency program director, Dr. Tom Oeding, is going to be
Yes.
there.
He was a guest on our show, so if you're interested, go check that out.
Yep. It's going to be so much fun, and it's sold out.
Yeah.
It is. Maybe there may be like 3 tickets left. I don't know. By the time people hear this, in a few weeks, it's going to be sold out.
Yeah. I wonder if we should do a second show.
That's a lot. I don't know. I think one's enough.
One's enough.
It's like a 650 seat theater.
Yeah.
It's a lot.
Yeah.
So I'm excited about the Englert Theater. It's gonna be great. I'm so pumped.
It's going to be really fun because that audience in particular is going to be full of people that we know and people we don't know,
and farmers.
And farmers. We're going to have to we're going to have to play up the rural.
I'm doing some farmer jokes. I got it.
I know. I feel like
I'm
you should
ready.
put your character in.
The rural medicine is not really a
rural.
Not exactly like that is the rural medicine videos were inspired by my time in Iowa for sure. But Texaco Mike is not on screen. He's not I can't.
There's ways around that.
Yeah. Could have him off stage doing something there.
Uh-huh.
We'll have to think about that.
Yeah. I'm just saying.
Probably come up with something.
It'd be pretty good. Anyway, it's going to be fun because that's a special place. A beautiful theater.
Second stop on our tour.
That's right.
I
would say come on out, but the tickets are sold out.
I'm scared. I'm scared for October though.
Yeah, I think it is literally every single weekend in October.
Boy, we're going to be busy in October.
We are in different cities in the United States of America.
Washington, D.C., Dallas, Houston.
Yeah. You know what I'm really glad, though? I'm glad we're not doing Washington, D.C. in November.
True.
That would be... Well, October might not be much better, but
it'd be
I feel like November would be
that's going to be a great one, too. We're also going to a historic theater, the Howard Theater.
Yes.
In Washington, D.C.
Cool.
So I'm excited. It's going to be fun.
Did you catch that I was referencing the election? I feel like you didn't catch that.
Oh, I thought you were just talking about weather.
The weather, right. That's what I figured.
Oh, November?
Yeah. Big election. Have you heard?
Is there? I don't know.
Are you new to planet Earth? Did you just get here?
I'm like, we're recording this right now. We're recording this in like the last dregs of my caffeine are starting to wear off. I can feel it, but it's like too early to get that second cup of coffee yet.
Because you might not make it the rest of the day.
Yeah, and then I have to get a third cup.
Yeah.
I promised myself I wouldn't do that.
Okay.
Like I feel like 3 is it's just like it's a lot. It's a lot of coffee.
Yeah, like now you have a problem.
Yeah. 2 is reasonable. 1 in the morning, 1 in the afternoon. Pick you back up after lunch.
Still.
No, 2's fine. 2 is. Okay. I'm sure. I think there have been studies.
I think the scale's different in the medical community. I think you guys tend to go high on caffeine.
We do love our caffeine.
Yeah.
But no. So anyway, hopefully you guys can come out and see some of our shows if we're coming near you.
Yes.
And I don't know. I just we're adding some fun things. Compared to what we started with. It's changed a little bit, but it's all going to be awesome.
Yeah. I mean, guys, not to brag, but it's a pretty good show. Like we have had feedback.
The hardest part is just packing up my costumes and transporting them.
Yep.
A lot of stuff.
This time we're gonna have even more stuff.
We do have more stuff.
So,
exactly.
It's gonna be some logistics. People don't want to hear about our travel logistics.
They don't. Okay, so let's keep going. How about, since we're talking about characters though, and the live show and stuff, should we do some lore?
Yes.
Some lore action.
Some lore.
Okay. All right. Yeah. Let's take a break and then we'll come back and do some lore.
Okay.
Today's episode is brought to you by the DAX Copilot from Microsoft. To learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit aka.ms/knockknockhi. Again, that's aka.ms/knockknockhi. All right, we are back for Glauc Talk, where the Glaucs talk. God. Thank you all for being here. Oh, God. All All right. So let's do some lore talk.
Okay.
We've
More
done
lore.
Yeah, we've talked about Jonathan. We've talked about neurology a bit as well. I thought we could do like anesthesia surgery.
Okay.
Those are, I
They're a
think,
pair.
yeah, they kind of go together,
Yeah.
and it's such an interesting dynamic. And I think that the operating room is a setting that gets people really excited because it's
Not me.
well, in terms of seeing like the comedy, the videos, like
Ah.
people love the surgery setting videos because
Yes.
that is such a fascinating ecosystem of personalities
And
and
high stakes.
there's high stakes. There's some anxiety going on there. There's then you get like your residents and your med students coming in for the first time into this environment and learning the ropes, and then you have
Standing by the trash can.
yeah, and you have your your nurses, your charge nurse, you have the patient, the surgeon who's everything revolves around the surgeon, or the surgeon likes to think everything revolves around them. And then the anesthesiologist is just like kind of chilling, So it's a fun environment to explore through comedy because there's a lot of material there.
Yeah. Does having gone through med school and surgery rotations, does it make you less well, nobody likes having surgery, but does it make you like it less? Like, does it make you more nervous, more apprehensive?
I think some people who know there's some med students who know they don't want to do surgery.
No, I mean when you're a patient.
To have
Like to have the
I see.
perspective of, seeing what it's like on the other side, does it make you want to be a surgery patient less?
No,
For any number of reasons.
because I know how particular operating room staffs are and how about protocols and timeouts and so I do want to make sure that it's a reputable hospital I'm going to.
Right.
And then but no, I love the operating room.
I just think sometimes, you've seen too much.
Oh, I mean, I've only seen eyeball surgery,
Oh,
so
true.
and I've seen some amputations. So I guess I'd feel
You
comfortable with
must have
that.
seen more surgeries than that in med
Yes,
school.
no, I have. I've seen other surgeries, but I am closest, obviously, to
Yeah.
eye surgery. I'd probably be more nervous about
Yeah.
that
What
than
does it
any
make
other.
you want to have eye surgery less? You
I
won't even get an exam.
Oh, I
so.
absolutely don't want to have eye surgery, but I know I have colleagues that I would trust to do my eye surgery.
Yeah.
And my family's eye surgery.
Yeah.
So yeah, I'd be a little nervous about it, but I think overall I'd be okay.
I
I
don't
was
think
actually
I would
just
want.
talking about this with one of my colleagues. One of my colleagues is like, he said he's going to have general anesthesia. He's so nervous about it.
Oh
So I
no.
think it's interesting coming from a surgeon.
Are you doing it?
No.
Oh, okay.
No, we were just talking about like what about like when we have to have cataract surgery.
Oh, okay.
And so yeah, I don't know. But any other surgery, I've had other surgeries, and
Yeah.
it's been fine.
Yeah.
I like the happy
Sometimes when you
juice.
see behind the curtain
I like
of something, it influences your
I
perspective.
like the
but-
Versed. Makes you feel,
Well, yeah, who doesn't?
makes you feel good. You get for that like 30 seconds before
Or like 4.
as they're wheeling you into the operating room, that's when they push it.
I bet you can tell how much they're giving you by what number they ask you to start counting down from.
Well,
If they
that's
give
when
you 100, maybe you'll be there a little bit. But if you're just starting on 10, they're like, you're going to be out.
Oh yeah, usually you don't get to 2 or 3 because by the time you start counting, they've already given you a little bit of the propofol,
Right.
and that takes just a bit to circulate. But I was going to say one of the underrated aspects of being a patient is riding in the bed to the operating room.
Oh, writing.
It's
RID.
riding. Like you're laying in the bed, and because that's
Do you
usually
get a lasso and just
well, no.
woo-hoo!
So it's cool because at least whenever I've had outpatient surgery, they give you a little bit of Versed, happy juice.
Yep.
Okay. Like in pre-op,
Mhm.
because anesthesia is there, and they're the ones usually that will wheel you in.
Mhm.
If you're having a surgery where you get wheeled in, I think a lot of surgeries do that. But
One
So-
time I had to walk in and lay on the table.
yeah, like
That
in
a little
Cataract
disconcerting.
surgery, you have to walk
Oh, no,
in.
this was a neck surgery.
Okay. Well, anyway,
I was nervous.
I really enjoy the feeling
Yeah.
of getting some of that happy juice.
Hmm.
So
And
you're
then going for a ride.
a little high, right? And then you go for a ride in the hospital, and they're just
Beep, beep,
pushing you
out of the
around.
way.
Exactly. Yeah. It's kind I don't know. It's kind of exciting. It's like, 'cause as someone who spent a lot of time in hospitals but having to walk everywhere, it's like, damn, this is nice.
First class
I
treatment.
get to ride in a bed, but then at the end of the ride, you have to
You
have
get cut
surgery.
open. Yeah.
So not as fun. But anyway, I kind of enjoy that.
That is one thing I do remember. Like, obviously, I'm not there when you're getting surgeries, but I have been there when you're like still waking up from the anesthesia.
Yeah.
Like you're awake, but you're still like coming out of it, and you get very giggly.
Yeah.
That's what you do when you
I'm a happy
have
drunk.
that stuff. You just giggles.
I like that going back to the riding in the hospital. I'm keeping remembering reasons why I like it so much. The
Well,
feeling
I know
of
what to get you for your birthday now.
a hospital bed that you can
Yeah.
wheel me around the house in.
Yeah, give you a ride.
The breeze. I remember the breeze.
Yes.
You know,
That
'cause everybody-
fresh hospital air blowing through your hair.
because they're wheeling you quickly because everything moves so fast in the hospital.
Yeah.
And like you're going fast enough that you feel
Just
it
on your face.
on your
Give
face.
me all those
and
germs.
you're making it less fun. Relax. God,
Oh,
what were we
what a
talking?
sad
Oh, the
life.
lore. I love it.
Yeah, surgery.
Looking forward to my next surgery so I can get wheeled around the hospital.
I'm just
When's that
picturing
gonna
you
happen?
6'4" with your
Yeah.
hospital socks sticking like 6 inches off the end of the bed,
Yeah.
getting wheeled around.
I don't fit in those very well.
I wouldn't think so.
I still have those socks though. The no slip
They
socks.
come in handy.
So anyway, back to the lore.
Yeah. Surgery, anesthesia.
The first time I did a piece of content about the OR environment was actually a Gomer blog. So I was writing these satire articles, and one of the ones I wrote was, see if I remember the title of it, was Anesthesiologist Swallows Pride, Develops Small Bowel Obstruction.
I don't get it.
Right. So it's a clever title.
Oh,
It's a clever title because
funny.
because part of the joke with anesthesiologists is that they get dominated by the surgeons. Like the surgeons that have such a big ego that they have to control every single aspect of the operating room, or they feel like they need to.
Right.
And so they will essentially like assert their dominance over everybody in the room,
Yeah.
including anesthesiologist, who, by the way, is also a physician. And so
Right.
the anesthesiologists, because they're like super cool and they just don't get worked up about
Yeah.
those types of, personalities and dynamics. They're used to it. So the joke is that they swallow their pride and not like fire back at the surgeon, just let the surgeon be there.
Oh, and the
Dominating,
pride is the small
prideful
bowel
self.
obstruction.
And then they swallow, and it's just a joke on swallowing something.
Right.
And they develop a small bowel obstruction.
That's funny.
Okay, I was really proud of that one. All
I
right.
said it's funny.
A few people did read it, but anyway. And but I love the dynamic between the two. It's just with and obviously I play it up for effect in the videos, but the surgeon being just so oblivious to the needs and wants and desires of the people around them, just having this gravity, this vortex that they assume everyone caters to them. And then you have the anesthesiologist who's just kind of aloof and just kind of goes with the flow. And I just,
this is reminding me of.
I'm afraid of what it's reminding you of.
Well, you are a surgeon.
Do you think I act this way in the operating room?
And I'm the anesthesiologist. No, not in the operating room. At home.
Oh yeah, because you're
at home.
Because you're so easygoing.
I'm so chill.
You're absolutely the chillest person I know. Jeez. That was a very surgeon thing of you to think right there. God. My God. By the way, we need to up your sertraline, I think. So,
that's rude.
just kidding.
Mental health's not a joke.
No, it's not. Of course not. So no, you are not. I think you could actually be a good surgeon.
No, I can't. My hands are not.
No. I mean, like from a
steady.
personality standpoint.
I don't think that's a compliment.
Just no, but you're like very attention to detail
Yeah.
oriented.
Yeah, that I am.
And you kind of have to be that way to a
Yeah.
certain extent.
I'm a good leader.
You're a perfectionist.
I'm a leader.
You're a leader. You just don't like blood and
I don't.
guts.
And my hands are shaky.
Your hands are a little shaky. Yes.
Yeah.
And you'd have to stand on a step stool.
I would. I'm too short.
Mm-hmm. But that's okay. They have that.
Could
I've
I
seen
sit?
pictures do that. If you're
without being an ophthalmologist?
Oh. Do
Like,
other
can I have a
types of surgeons?
special? I can't stand that long. I gotta be able to shift position. I don't know how people do it.
Yeah.
No one
I
cares
think
anymore.
ENT maybe they sit I don't know, to be honest. So maybe you could be an orthopedic surgeon.
I do like to take out my aggression sometimes. That would be fun.
Do some hammering, do some malleting.
Yeah.
So do you have any, let's see, what else, what can I tell you about the characters in between anesthesia?
Anesthesia. How did you come to develop all their little idiosyncrasies? I mean, you're talking like general personality.
Yeah.
So we've covered that. But each of those characters has like some very specific traits or qualities.
Yeah, the surgeon, I
actions.
guess, is if there had to be a villain in the cinematic the GCU,
Mhm.
Glaucomflecken cinematic universe, it would probably be the surgeon, the general surgeon.
Well, now hold on. You've got private equity. You've got
Okay, well,
Bartholomew
yeah.
Banks.
That's true. I do have
got
other
The
legit,
insurance guys that Jimothy works for.
but I have depicted the general surgeon in a negative way a few different times.
Mhm.
And I choose surgery for that because not that they are, because they're wonderful surgeons. Like I'm friends with surgeons. I know lots of surgeons, and they're very not analytical. They're very it takes a special personality to do surgery.
Yeah.
You have to be have a lot of confidence,
Mhm.
right? And so but I feel like they can also take a joke really well.
Yeah.
So that's why I've kind of poked fun at them a little bit
Right.
more than other specialties, I would say, because I know they can take it.
Because they got all that confidence.
They got all that confidence. They're like, yeah, you can make fun of me, whatever. I know who I am. I know what
Right.
I do. I know what I'm good at.
Yeah.
So, and there's something to that, because certainly if I have surgery on something, I want my surgeon to be crazy confident.
Yes.
If you
I
lack,
don't want them to be crazy confident.
well,
I want them to be sane confident.
well, the point is though, lacking confidence is not a
Yeah.
great thing for a surgeon.
Right. But too much is also not great.
Sure, you got to know your
Appropriate amount of confidence.
Yes, you have to know your limitations. Otherwise, you end up like our friend Gerald there behind you.
Yeah. Skin and bones. Except he doesn't have any skin.
That'd be weird to see a skeleton covered in skin.
Just skin.
Just skin.
No muscle.
Yeah.
No
that doesn't work
connective
that way.
tissues. No organs.
All right. So anyway, that's all I got. All right. So those are like the surgeon quirks.
Yeah.
As far as from the anesthesia side, I guess I feel like surgery and anesthesia, they balance each other well.
Mm-hmm. Yin and yang.
Yeah, because whereas the surgeon is very, I don't want to say aggressive, but like confident and
action oriented.
Yeah. They tell you what they think and they get what they want, and they expect to get what they want, kind of thing. The anesthesiologist has to even that out a little bit by being a little bit more, go with the flow. There was some of the big jokes about them is that they're always taking breaks.
Yeah.
They love taking breaks. So as opposed to like the surgeon who's like no work-life balance. That's like the running gag for them. anesthesia just they have unlimited work-life balance. They love it. Now their job is hard because
You don't want to kill the people.
well, they're keeping. They basically what anesthesiologists do is they keep the surgeon from killing the patient.
Mm-hmm.
That's essentially what they're doing, right?
Yeah.
They're keeping the patient alive while the surgeon is like cutting into a patient. So in a way, they're basically their job is to keep the patient alive while that happens.
That's an interesting. Okay, so keeping them alive.
Yes.
How are they counteracting something? Like that makes me think they're counteracting
Right.
something. What
They're-
is happening?
They're helping control the breathing of the patient, the blood pressure.
Okay,
the-
so if they weren't there, the natural response to being cut open, even if you're unconscious, say,
Would
like
be
you
to
fainted or something,
bleed to
then
death.
you would
Yes.
have these.
Yeah.
Oh, I've never thought about that.
Yeah, that's what they
Yeah.
do. Is they're
I just thought they were there to make it where you didn't have to experience it. That's all I've ever thought. About
that's one of the
anesthesia.
benefits of having an
Right,
anesthesiologist.
but like for me,
yes.
in my mind,
No.
as just a patient, that's the purpose.
No, they're
I've never considered this other thing.
they are there to keep the surgery from killing you.
Well, that's lovely.
But they're good at it.
Yeah,
They're very good at
I'm
it.
just about 10 times more afraid to have surgery now, but cool.
That-
Cool.
Okay, that's a very it's an embellishment, obviously, but if you like drill down into the essence of what it is that's
Yeah.
happening in the operating room, that is basically what's happening. And so what's so cool about anesthesiologists is that it so little phases them.
Yeah, I don't understand. I mean, it's good, but like, how? If that were me,
Yeah.
I'd be a nervous wreck.
Well, see, the thing is, their job, there are long stretches of time where they just get to kind of like they're monitoring things and they're giving medications and stuff,
Mhm.
but they can chill out a little bit, right? They can check their investment portfolio. Yeah, I don't know. Do their Sudoku books.
Sure.
That's where all these jokes come from. But those periods of time where not a lot's happening are punctuated by like 5 to 10 minutes of sheer terror
Yeah.
when things do happen.
Okay.
When a patient has an arrhythmia on the table, or when they've have a stroke, or
Do they have to tell you if that happens while you're having a surgery, or would you just never know if you're the patient?
Oh, if you had like a complicated course, then yeah, those things are told to
I
you.
don't know what that means.
Something that happened that was not supposed to happen, that is out of the ordinary, that might affect your recovery.
Even if it was just like a little blip and they fixed it and then carried on. Like you had an arrhythmia for a little bit. I mean,
I
maybe that's a bad
honestly,
example. That doesn't seem like a blip, but
yeah. Well, no. I mean, I think anything that doesn't go according to plan.
that would like be in your notes. after.
Yeah, like as the patient, I'd want to know about it.
Yeah.
Like I'll give you an example. When I had my first orchiectomy, the surgeon came in afterwards, said they accidentally cut through a nerve
Yeah, that was your second one.
to my second one to that caused a loss of sensation like
Right.
along my thigh.
Yeah. He came in and told me
And he
that.
told me
too.
that. And so that's an example of something that didn't go according to plan, but was
Yeah,
still
that's
told
like
to
a
me.
big oopsie though. But what about if like what you just said, like let's not use arrhythmia because that's kind of loaded. But like let's say I was having surgery and my blood pressure got really high,
Mhm.
like really high. And then they just brought it back down and it was all cool and they continued on. Do they have, would you know that?
Yeah,
Or
you might not know that. Especially if it's because those types of things can happen. The blood pressure can fluctuate. And if it didn't cause any adverse event, any
Yeah.
long-term changes, it was just part of kind of a normal ebbs and flows of surgery,
right.
then that wouldn't be something that you necessarily would think to disclose to a patient.
Right.
Um,
Yeah, that's what I'm asking.
yeah. So, and
ultimately, I just want to know like how good of an unconscious patient was I?
I'm sure you behaved yourself quite well. All right. So do you have any other questions about anesthesia and surgery?
You know what I want to know? I want to know what these people. I mean,
Why the
maybe
anesthesia-
anesthesia because it sounds like surgery. this wouldn't apply, but I would like to know what they do as a hobby, you know?
Prob-
Like out of the operating room. Obviously you got their Sudoku books and stuff, but when they're just out in the world as a
Mhm.
person,
Probably like just what any normal person
well,
would
there's like
do.
a personality type, right? Like this is your
Oh,
whole
I see.
bit. Is that
Oh,
what would
gotcha.
this personality type want
I
to do for fun or to
Okay.
relax?
I'm gonna make a total guess.
Okay.
I would say general surgeons collect classic cars.
Yeah, I could see it.
Um, they anesthesiologists, they own Teslas and are very vocal about their love of Tesla.
Okay.
Um,
Why?
I don't know. I'm just making stuff up as
Okay.
I go along. I think they're probably an anesthesiologist would probably be into archery.
Archery.
Yeah,
Interesting.
yeah.
Very specific.
Yeah, it kind of seems like an archery type of thing.
Obscure.
Yeah, just kind of like they're trying to find like weird things to fill their free
You don't
time
think
with.
they'd be like a skydiver?
No. That's like that's emergency medicine.
Sure.
Yeah, no. I don't think they're the anesthesiologists are not the I don't think they particularly like feeling stressed and like a big, you know,
Yeah.
adrenaline rush.
It's just this is what I'm trying to wrap my head around though, because it's such a conflict, right? That like they are the person that is keeping the patient alive.
But
That's high stress, high
but
pressure.
that's a controlled environment. That's the difference.
Yeah.
So they control the environment. They know what they're getting into. They know what the plan
So they're
is.
control freaks.
I think probably to a certain extent, yeah.
Maybe have a little OCD sometimes,
I
some
think
tendencies.
I think all
They like their
physicians
coffee table books positioned just so.
probably. Yeah, they don't like it when people sit in their chairs.
Yeah.
I guess the butt mold gets messed up.
Oh, yeah.
I
And
don't
you
know.
might change the height.
Yeah. But I think that's a big difference with anesthesiologists is typically they're in a controlled environment. So
Mhm.
what you might think of as a very stressful thing, keeping a patient alive, that's routine to them.
Yeah.
But then there are those moments when a patient all of a sudden starts dying on the operating room table
Right.
and they have to act quickly.
So they have to be good under
They
pressure,
do.
but they don't like pressure per se.
I don't know anybody that likes pressure except for maybe
Emergency
emergency
medicine.
medicine.
Yeah.
Yeah. So I don't know.
I'm just saying, I sound like an anesthesiologist. That's all I'm saying.
Let's hear from some anesthesiologists. Do you think Kristen would be a good one?
I'm good under pressure, but I don't like
Do
it.
you like chemistry?
Yeah, I like chemistry.
So.
Okay.
Okay.
Yeah.
All right. Well, let's take one more break.
Okay.
All right, because we've got one more thing to do.
Okay.
Hey, Kristen.
Yeah.
Would you rather have like 1,000 Demodex mites on your eyelid or just one of these little guys?
I will have one of those, please.
Because they're so cute.
Yeah.
Yeah, look at them, little eyes, and they
I
got their
know.
feet, and they're just
They're
kind of
soft,
just
but
crawling all over your body.
Are there really 1,000 Demodex mites on eyelids?
Oh, I don't know. Probably not that many.
Okay.
But they can be numerous.
Yeah.
And they can cause Demodex blepharitis.
Yeah, I don't think I want that.
Yeah, you get like red, itchy, irritated eyelids,
Mhm.
flakiness,
Yeah.
crustiness. Yeah, they can cause some itching.
fun.
Yeah, it's not real fun. But you shouldn't get grossed out by it. I can look at your face and tell you're a little grossed out by this.
I don't want that.
Don't get grossed out. Don't get freaked out. Get checked out.
Okay.
All right. To find out more, go to eyelidcheck.com. Again, that's EYELID check.com to get more information about these little guys and Demodex blepharitis. All right, we're back. Did I answer? Do you have a good sense of what an anesthesiologist does now? You seem very interested in
I know
this.
what they do. I'm interested in this person. What I'm really trying to figure out is like, how does one decide to become like what personality type
Oh.
is a good fit for anesthesiology? That's kind of what I'm trying to figure out. Because like, sure, once they are an anesthesiologist, it's all a controlled environment. But what might attract you to that in the first place, other than like other factors, like lifestyle factors, obviously. But
I think a lot of med students, they like the operating room environment,
yeah,
but they don't necessarily
Want
want
to
to be
operate.
doing the surgeries, but they like being there.
Yeah.
You also have to be a morning person.
True.
But the thing is, they got really good work-life balance because usually toward the end of like they're on their way home like 3 or 4 o'clock,
Right.
even though they got to get up at like 4 o'clock in
3
the
or 4
morning.
o'clock.
But still, they do. I think of it as a nice work-life balance, which is a wonderful thing to want to pursue.
But any
in medicine.
personality type, well, many might want
As opposed to
a good
surgeons.
work-life balance.
Surgeons like
workaholics.
Well, surgeons, they're like the only place that they can be happy, truly happy, is in the operating room. That's like a classic stipulation for like wanting to do surgery.
Yeah.
Like other types of doctors, they could be happy doing other things. Surgeons, that's all they want to do.
Yeah.
They can't imagine doing anything else besides like operating.
Right.
So anyway.
That's fascinating. I like all the personality stuff coming from a psychology background. That's interesting to me.
So do I, but strictly from a comedy standpoint,
Mm-hmm.
not from an actually, philosophical or
Yeah. Well, I would be interested to hear from
psychology
people
background.
who are surgeons or anesthesiologists or who are attached to one.
Give us some insight. That could help me too in my content. So, all right. So, a couple times, I think, a couple episodes ago, I asked our audience to send some of their marriage problems because I think we could possibly launch a career. Like
as
a little side
unqualified
gig
marriage counselors.
as completely unqualified marriage counselors.
Okay.
All right. Nobody sent us any, but one of our producers, Rob, has helped us out.
Okay.
So he asked ChatGPT for marriage problems. Like, what are some marriage problems? Common marriage problems. But what he got from ChatGPT was like too boring.
Okay.
And so what he amended his
prompt
inquiry to make it more specific and weirder.
Perfect.
So we got some good ones.
Okay.
All right. So here we go. The
hypothetical
first one,
marriage problems.
These are totally generated by artificial intelligence. Okay.
That's about who we are qualified to help.
I see this as a trial run.
Yeah.
We see how we do, and then maybe it will compel people to give us their actual marriage problems, and we can it'll lend a hand. All right. So the first one here.
Listen, don't send us something that's like you're gonna get a divorce over it.
Oh God, no.
Like,
we're not. Again,
we're not qualified.
I cannot stress this enough. Nobody should ever rely on our advice for anything to do with their marriage, but you should totally listen to what we have to say.
Yeah, if you want some really unqualified.
Yeah, I will be truthful for you.
Semi-qualified. We have managed to stay married for a while
and we work together.
Yeah.
That's something.
So we have life experience, but no qualifications other than that. Okay,
Cannot
just a disclaimer.
That enough.
Yeah.
Cannot stress that. Okay, here we go. So the first marriage crisis here, the pet obsession. So here's the problem. One partner has developed an intense and exclusive bond with their pet.
Exclusive?
Treating it almost like a child and prioritizing its needs and wants over their spouses. They spend a significant amount of time and money on the pet, even going so far as to cook gourmet meals for it.
Okay.
Arrange frequent play dates and include the pet in all aspects of their daily routine.
All aspects?
The other partner feels neglected and sidelined, as their spouse's affection and attention seem solely focused on the pet. This leads to feelings of jealousy, frustration, and a sense of being unimportant in the relationship.
Okay.
What say you?
What kind of pet?
I'm gonna say.
I feel like that might.
I'm gonna say important. It's a parakeet.
A parakeet.
Yeah, it's a bird.
A bird.
Mm-hmm.
I was just imagining. It says it includes the pet in all aspects of their daily routine, and then you said it's a bird, which made me think about how birds eat out of the other birds' mouths, and so then this person just like opens their mouth with their dinner, and the bird eats the dinner out of it.
That's exactly what's happening.
That's what I'm picturing.
And then they're like, when they go take a shower, the bird's right on their shoulder. There's anytime the sleeping, the bird's right there.
I'd imagine there's a lot of a bird excrement all over the house.
I've never owned a bird. Have you ever owned a bird? You've had a lot of pets in your life.
We have owned birds, yeah. Yeah, nothing like fancy, not a parakeet or anything, not a parrot. But like we had like finches or something.
Here's a question: would there be any pet that this situation would not be a problem? Does it matter what the pet is? What if it was a cow?
It's not that it doesn't matter. It would be just it's informative. It's important to know because it might change. Like that's gonna affect what the situation is.
So let's imagine
Yes.
it's me.
Indoor pet, outdoor pet,
So
small, large.
our dog,
Yeah.
our standard poodle,
Okay.
Milo.
Yes.
Imagine I have generated
It's not that hard to imagine. You're pretty close.
a very tight bond where you start to feel like I love him more than I love you.
Yeah.
What would you say to me?
Well, you do
that?
snuggle with him more than you snuggle with me. So this is not hard to imagine. In fact, I had to fight pretty hard you're not like a physically affectionate sort of person. So the fact that it came so easily to you to snuggle with this dog.
Rob, did this really come from ChatGPT? I feel like you're in cahoots, the two of you.
No.
Okay.
I'm just speaking my truth.
I think the person with the unhealthy pet obsession needs to tone it down or face some consequences.
Okay, what kinds of consequences?
They need to share the love a bit.
That's not a consequence.
I don't know. I don't know what would be appropriate.
What would be a fair consequence? I think that the spouse needs to be able to eat out of their mouth and ride on their shoulder.
See, this is what I mean when I say we're not qualified to address these problems. I think, well, if you're feeling, I understand that you're feeling jealous and frustrated about me and Milo's relationship.
Some empathy, maybe some active listening. I like this.
And that you don't feel important in our relationship. But if you want, I will pick your poop up as well. If that would make you feel better.
Do I have to go in the woods?
It's helpful if you would do that. Stay away from the lawn, please. It's nice. I don't like stepping in poop. The woods would be better. And just let me know, indicate in some way that you've gone and point it out to me. And then I think by doing that, we can start to work on our relationship a little bit.
But when you take him out, you anticipate his needs and you take initiative and take him out and you go with him and you watch him.
Hey, you want to
while he poops.
Do you have a leash? I don't. Something tells me I would get in a lot more trouble if I suggested that. I don't think this is. I don't. I don't think we're going to come to a conclusion here.
Okay.
On how to fix this.
Okay.
That's a tough problem, though. Does that exist in real life? Maybe. I don't know. People are very attached to their animals on social media that I see.
This is true. I would say too, to be fair and play devil's advocate.
Okay.
You got to think about both sides, right?
True.
So perhaps the person who has an unhealthy obsession with the pet. Now, this is no longer attached to our real life situation. Perhaps the person with an unhealthy obsession with the pet also feels neglected by their partner. And that is why they have developed this unhealthy obsession. Because at least the pet shows them attention and they anthropomorphize that into love. If it's a parakeet.
That's pretty good.
I don't know, can birds love?
See, I think you've got it. I think you've got something here.
I think both partners, perhaps, need to pay a little more attention to giving to their partner rather than focusing on what they would like to take from their partner. What their partner's not giving them. because I think when you focus on giving to your partner, then they reciprocate. Then it works out better for everyone.
Is it possible that this is going to help our marriage as well?
I told you this is no longer tied to our particular situation.
All right, there you go. The pet obsession. Should we do one more?
Okay.
You're enjoying this, aren't you?
Yeah, this is fun.
All right, here we go. This next one's called the obsessive collector. All right, here's the problem. One partner is an avid collector of unusual items, specifically vintage clown memorabilia.
Okay.
Their collection has grown so large that it has taken over significant living spaces in the home, including the dining room and bedroom, creating clutter and discomfort for the other partner. The non-collecting partner feels overwhelmed and stressed by all of the clown noses and giant rubber shoes, which leads to frequent arguments about space and cleanliness. They may also feel embarrassed or frustrated by the extent of their partner's hobby.
Oh, gee, I cannot relate to this at all. Is the partner's clown memorabilia, are any of them full-size skeletons, for example?
I don't know what you're talking about.
With headwear.
We did put Gerald back behind us with a unicorn headband.
And I have actually walked out from a meeting into my home and stumbled upon you in clown face paint, crying fake tears.
Oh, that did
into
happen
a video
once.
camera.
Yes.
So,
did
you know,
happen
I
once.
can relate to this person.
Dang, Chat GPT is a little bit too good today. Okay. So what if instead
Also,
of
we have an entire closet in here that is full of garbage and toys that are, quote, props.
Okay, but what if instead of what I do, what if I was making like clown satire videos and it was just all clown
That would
stuff?
be even more embarrassing.
Would it?
I think so. Because clowns have like a whole thing attached to them. They've got a bit of a PR problem.
What if I was a rare insect collector?
I'm out.
That would be a deal breaker.
I can't live in a house
Can't
with
do it.
insects.
Well, you know,
I just couldn't.
But you know how important it is to me.
Well,
that I collect,
we can stay married, but we're not going to cohabitate. You're going to have your own section for
of the house
or something, your own house. You got to move out to the barn. That's what we would do. You would move to the barn with your insects.
Most of the rare insects are not alive.
I know.
That's still still no. Like
no.
the press board. It's
no.
like
nope.
It's very nicely and well organized.
That's I see where you're going.
Still no.
But I can't.
My Guatemalan hissing cockroaches are not something you can be in the same room with.
I can't look at insects and relax in my home.
You wouldn't let our daughter get a
snake. Not as a pet in our home.
Why?
If the snake wants to live in the barn, great.
Okay.
Like in an appropriate enclosure in the barn, I would allow that.
I think you were okay with the snake idea until you learned that they mostly eat frozen mice.
I wouldn't say I was okay with it. I would say the frozen mice was the nail in the coffin.
You need a vegetarian
that you have to
snake.
Feed these snakes mice, which then means that you have to keep dead rodents in your freezer.
That's right.
It's a no-go for me.
No.
I'm out.
You're done?
No, I'm not doing that. But if there's like a separate freezer in the barn and the snake lives in an enclosure in the barn and nary the two shall meet.
So that's the way to
snake and I. Then fine.
That's the way to fix the marriage to the obsessive collector is.
Yeah, you need to give them a space.
Give them their own space.
Where they can keep all that stuff and keep it out of your sight, which incidentally, as I am saying this, I am realizing is exactly what we have done. You have a prop closet.
I do.
And also we have separate closets.
Yes, we do.
With a door that I can just shut and not have to see your mess. And then that way you can clutter to your heart's content. You can just throw everything anywhere you want. And I don't even have to see it. And it's what keeps the magic alive.
So the key to this conflict, to resolve this conflict, is just divorce.
Well, now, That's not what I said.
Okay,
But
living
some
separately
separate
out
spaces
of
of some kind would probably be something to
Okay.
consider.
All right. I think that's fair.
Yeah.
That's good. It's worked for us so far,
Yeah. Everybody gets what they need.
but there are limitations. And then once I start dabbling in rare insect collection,
Yeah.
that's kind of it.
You're out in the barn at that point.
Okay.
Yeah.
There you go.
Get yourself a barn.
So if our thoughts on these two issues, if you're thinking, wow,
That's insightful.
they are so good at this, then give us your marital issues. Nothing serious. Like it's got to be something weird, but not like weird in a really weird way. Just
Keep it like PG.
like normal weird.
Yeah.
We'd love to help you out.
Yeah.
Again, and I can't say this enough times, we are not qualified to do the thing I'm asking you to do.
Unqualified, but probably funny.
It'll
marriage
be
advice.
entertaining at the very least.
Yeah.
Knock knock hi at human-content.com. Oh boy. Okay. That's it for today. So thank you all for listening. Again, give us your thoughts on any topics you want us to discuss together, not just marital issues, but anything.
Yeah.
Healthcare related. If you want, I think it was interesting conversation trying to explain the personalities to you about the different specialties. We can do that for other specialties too.
Yeah.
Because someone who's not in medicine, you don't
Right.
have that insight. So maybe it'll help other people gain some insight into some of these personalities.
Right.
So again, you can email us, knockknockhi at human-content.com. Visit us on our social media platforms, and you can also hang out with our Human Content podcast family and see all the offerings these days at Human Content Pods on Instagram or TikTok. Thanks to all the wonderful listeners leaving reviews and feedback. We love those. If you subscribe and comment on your favorite podcasting app or on our YouTube channel, we can give you a shout out, like at KXNOXUTA on YouTube said about the new podcast channel. I was wondering where your episodes went and how now I find you here. Glad I found you because the announcement didn't find me. Maybe you want to make another short about that. I think this is our producers telling me to
probably
start promoting the YouTube channel a little bit more.
Probably so.
It's a good idea.
I'm glad
It's a good idea
that you found it.
We switched the video podcast episodes from my YouTube channel, which is Glaucomflecken, over to just Glaucomflecken. At Glaucomflecken.
Yes.
So we just wanted it all in one space for people. And then you can go to skits on the other thing. You just separate the two. And
see, separate spaces. And we're back.
And people like it. People are liking it.
Yeah.
So anyway, I should probably do a better job making people know that that's what's going on there. Full video episodes are up every week on our YouTube channel at Glaucomfleckens. We also have a Patreon, lots of cool perks, bonus episodes, react to medical shows and movies, hang out with other members of the Knock Knock High community. We're there, active in it. We're developing our little township, early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, new member shout out to Julia W. Hi, Julia. Shout out to the Jonathans. Patrick Lucia, Sharon S., Omar Edward K., Stephen G., Jonathan F., Marion W., Mr. Granddaddy, Caitlin C., Brianna L., K. L., Keith G., JJ H., Derek N., Mary H., Susanna F., Jenny G. A., Jenny J., Mohammed K., Aviga Parker, Ryan, Mohammed L., David H., Jack K., David H. again, Gabe, Gary M., Eric B., Medical Meg, Bubbly Salt, and Pink Macho. Patreon roulette time. Random shout out to somebody on the emergency medicine tier. You helmet wearer, you. Crystal T. Thank you, Crystal, for being a patron. And thank you all for listening. We're your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Executive producers are Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brook. Notice I'm first in that.
Shanti, help me.
Just saying. Editor and engineers, Jason Portizo. Our music is by Omer Benzvi. To learn about our Knock Knock High's program disclaimer and ethics policy, and a lot of you have been asking about this one, submission verification and licensing terms. Also those HIPAA release terms. Go to Glaucomflecken.com or reach out to us, Knock Knock High at human-content.com with any questions, concerns, or fun medical puns, if you have them. Knock Knock High is a human content production.
Knock, knock, goodbye.
Hey, Kristen, you know what I had to spend a lot of time doing yesterday after work?
What?
Clinical documentation.
Womp womp.
It's terrible. Like not only just patient charts, like prior authorization paperwork,
Mm-hmm.
that paperwork that you don't even know that there was paperwork for. I mean, it's just
A lot of
it's
documenting.
so much documentation. You know, I really could have used
What?
the DAX Copilot from Microsoft.
That would have helped.
It would have just taken so much more off my plate. I honestly, can I give you some stats?
I
This is
love
pretty impressive.
stats.
Yes. 90% of patients say their physician spends less time on a computer when they use DAX
I
Copilot.
believe that.
All right. Furthermore, I got more. 80% of physicians who use DAX Copilot say it reduces cognitive burden.
It's always good for you to think less hard.
Oh, man. I want to. No, okay. I'm preserving my thinking for the more important things.
Mhm.
And 62% of physicians say they are less likely to leave medicine or their organization.
That seems important.
It is very important. To learn more about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit aka.ms/knock-knock-hi. That's aka.ms/knock-knock-hi. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.